titled Health Spark. The idea is it's going to be our health conversation space. We're looking at bringing together all the social media channels discussing health into a single place. So a place for health conversation and community action. I'll come on to why we say community action in a second, but it is a one-stop shop full of conversation on health in York, and it can be developed further to cater for national and further down the field. One of the main key benefits is going to break down the barriers between people, healthcare workers, people in the health industry, and join those conversations together about specific topics. So there's going to be two elements to it. First, and to use the term that we've been trying to avoid, is going to aggregate social media data. We're going to bring it all together into a single location, identify trending topics, allow people to rate conversations and identify the important piece of information that are being discussed at a time. As well as that, we will use this as a tool to then provide a facility for healthcare departments, public sector, to raise topics within the social media space related to healthcare, track those conversations in order to devise actions or further decisions to be made on what happens based upon the community opinion, whether that's decided on then or based upon the community opinion, or it's just used for research. So we've got various other facets to it. So we might have sponsored conversations. So companies may pay for a conversation about something, and it would enable specific tracking to be applied to those conversations that surround it, and then allow research to be made or drawn from it. We'll have sponsored pages, so there'd be advocated pages, so we might have specific celebrity type people in the healthcare industry, or figureheads should I say, advocating a topic in order to spark that conversation. People will be able to subscribe to a digested version of the topics, so every day they might be interested in depression, they could find the latest trends in depression conversations. It could enable charities to find match funding with actual authorities or maybe drug companies or whatever, in order to find out more information about their specific interests without having to find all the funds themselves. It'll give community intelligence. Because all our social media is tracked with geocodes, we can collaborate that information to specific groups if we need to, rather than just having a worldwide conversation about it. So if people are talking about depression, well, what specifically are people talking about depression in York? Is there something about York that raises more reason for that sort of topic of discussion? Because of the identification of these health trends, it will allow people to realise areas of the health industry that need more further conversation, whether it be higher up through the public sector or local community areas, because that's the topics that are important to the people that are discussing them on social media. Gaps in provision?
Yeah.
I don't know that one.
It's like health pressure points in...
Yeah, okay, so it's going to identify these pressure points. And then it can be used for specific research topics for academics or the universities alike to follow up.
That's it, well we've got the interfaces down.
But yeah, we have a rough interface, so one part of the interface will start discussing it with topic first, so you'll pick your area of interest and you'll follow that thread into a collection of all the conversations related to, say, for example, children or the elderly or health. Then you could also focus on your local area, and it'll identify the trending topics and the trending conversations that are important. Some of them may be sponsored, for example, Bupa may be doing a big push on elderly care, and anything discussed with elderly could be sponsored by Bupa in order to fund the operation. But it would act like a very dynamic and very real-time infographic about the health issues in a specific area or for a specific piece of information. So with visual graphs and identified, and sort of community groups can be identified to bring people together. So specific topics are allowed people to collaborate on in this public space. But the idea is to bring the world's voice, to encourage them to talk about the health, talk about these issues, that have a conversation with people that are important, raise these points that may be just kept under the rug or not discussed into a single centralised location, so that...
And spark action.
And spark the community action. Yeah. Done.
Excellent.